My name is Alaha Alazada, and for my community nursing presentation, I will be talking about certified nurse midwife. Certified nurse midwives have been assisting women in all stages of pregnancy, from puberty all the way to menopause since 1925. They work with OBGYNs in primary and specialty care for women. They can also diagnose, treat, and manage the care for patients and women with acute or chronic illnesses. They can conduct physical examination, interpret some lab values. They can order and manage tests and diagnostic tests. They can deliver babies and attend pregnancy related issues. In some states, depending on which states you live in, you can, certified nurse midwives can even prescribe pharmacological treatments. Certified nurse midwives also can counsel and educate clients. Teaching and learning strategies. These are very important for a certified nurse midwife to know because that's basically what the patient or the woman that's pregnant or about to have a baby, they're going to go home on knowing how to do. This can be a great help by educating pregnant women on the health issues that they might face during pregnancy, delivery, and even postpartum. Problems like such as infection, anemia, hemorrhage, preeclampsia, and eclampsia. The certified nurse midwives also need to learn and know how to educate mothers in breastfeeding. As we all know, breastfeeding is a very important time in a child's and mother's life. That's when a child bonds to the mother and the mother bonds to the child. So the first time that the mother is breastfeeding their child, certified nurse midwives needs to be there and explain to the patient how to do it properly in order to get a good connection between the mother and the baby. Educational preparations for a certified nurse midwife, they need to have worked at least minimum of 2 to 4 years in a midwife related field. They need to be accredited by the ACME, which also stands for Accreditation Commission for Midwifery Education. Requirements for the program are 4 years of BA or 4 years of Bachelor's in Science degree. They need to have a current license as an RN, pass the NCLEX and the GRE. As we all know, with other disciplines, it's very important for not just the certified nurse midwife, but any kind of other nurses to be able to communicate with the other disciplines in regards to a patient. Sometimes it actually more often it happens when the nurses feel like they cannot contact the MD for certain orders because they feel like it's not something to be bothered with, or we shouldn't call the MD for this at this late at night and stuff like that. But it's actually very important to relate any kind of a complication, signs and symptoms, or even if the patient is not feeling like normal, then you should still be able to communicate with other disciplines. That is what our American College of Nurse Midwives evidence-based practice tells us to do. That if we do collaborate with other disciplines such as MD or whoever is involved with the patients in that regards, then we will have a high level of patient satisfaction and a higher quality care with excellent outcomes. We will be able to lower the cost of readmissions, and we will have fewer unnecessary and inexpensive interventions to be done. Necessary skills and abilities for a certified nurse midwives are: they need to have a strong evaluation skills. They need to have the ability to effectively communicate with the patient's family member, and the team that is working with the patient, such as the MDs, the PCTs, the physical therapy, the occupational therapy, and all of them. They also need to have a compassionate or caring attitude towards the patients, because believe it or not, patients know if you are in a bad mood or if you don't want to take care of them or you don't care about them. They can kind of feel the sense. So the certified nurse midwives need to have a compassionate or caring attitude towards the patient. And they need to also have the ability to deal with people of different levels. This includes like being culturally sensitive as well, because certain cultures, as we know, are different in the way you need to treat those people. One example is, for instance, Muslims. Muslim women, for instance, they don't like having any male people in the room, regardless if they are a doctor or not a doctor. They would rather have somebody who's a female when they are delivering a baby. So if the certified nurse midwives are as well culturally sensitive, then it would make better place for the patients to get treated. Interesting things that I have learned doing this project of a certified nurse midwives has been that I never knew how much births they attend per year, and apparently it's 317,000 births per year, and it keeps increasing with each year. And also, the term nurse midwifery covers a broad array of fields of study in women's health, all aspects of childbirth, like I said previously, from puberty to menopause. They also deal with in interactions like family violence and child abuse, and social issues such as poverty and alcoholism. These are all of my references for this project.